previous segment on Cure Connections today, we discussed what a BRCA mutation is, and we also learned about the risk of cancer in people who have this mutation. We're now going to focus on the treatment options for those who do test positive for the BRCA mutation and already have a diagnosis of ovarian cancer. Diane, you did not have ovarian cancer, but you did actually undergo the testing for ovarian cancer for the increased risk of developing the disease. What surgery did you end up having after you developed this, after you had the result that showed that you had this increased risk?
So I took about 2 years to go through high-risk screening for breast and ovarian cancer. While I was researching my options, I attended forced support meetings and learned from other women what questions to ask doctors and what their options were that they were given. And I really just kind of empowered myself with all of this knowledge. And then I decided to have a prophylactic oophorectomy and also a prophylactic bilateral mastectomy with reconstruction.
So for those people who are listening to this who are not familiar with the terms, the term prophylactic meaning preventative.
Correct.
And oophorectomy, both ovaries were removed.
Both ovaries and fallopian tubes,
and you had that done at the same time? Both sides were removed together?
Yes, yes.
Was that keyhole surgery that you had done?
I'm sorry?
Was that keyhole laparoscopic surgery?
Yes, it was.
And then you also had a double mastectomy?
I did.
And how soon, what was the time interval in the surgery?
So I chose to do both surgeries at the same time. There are some women who do that. Other women choose to space it out over a period of time. But I was working full time and I had 3 children, and so I thought it would be a good option for me to do both surgeries at one time and have one recovery period.
So going through laparoscopic surgery,
Yes.
no scar on your abdomen,
No.
but the surgery to have a bilateral mastectomy,
Yes.
did you undergo reconstruction surgery
I
as well?
did, yes, I
At
did.
the same time?
Mm-hmm.
So a huge amount of surgery to go through.
All in one day, yes.
And having gone through the surgery, everything, and the reconstruction, do you have any regrets about doing the surgery?
I do not. My risk has been lowered down to 1 to 2% now for breast and ovarian cancer, and I just feel confident that it was the best decision that I could make for myself.
And from the emotional perspective, was it the right decision for you to do everything together and move on and be done with it? Or in hindsight, do you think it was too much surgery to undergo in one day?
No, I felt like it was a good decision. I don't look back and regret any of the decisions that I made. I feel really good about them.
Dr. Secord, that's something that you'd recommend for patients who test positive for the BRCA mutation to undergo the surgery of both at the same time?
I'm not going to go to that question. I think that's a really individualized approach. Like you said, not all women choose that.
No.
And sometimes the breast surgeons feel very strongly about not doing that. And it also depends if the patient decides to have the uterus removed at the same time, because there could potentially be increased risk of infection with the hysterectomy. So great conversation to have with your surgical teams. And figure out what's best for you.
So there's medical reasons to do one, and as well as emotional reasons. So these issues need to be carefully discussed with your own doctors.
Absolutely.